Essentials of Pharmacology for Health Profession, Not Physicians. Chapter 21, Musculoskeletal and Anti-Inflammatory Drugs. Our chapter objectives are: identify the commonly used skeletal muscle relaxants and their side effects, list the drugs that can interact with the muscle relaxants and cause serious potentiation of effect, differentiate among the anti-inflammatory drugs and anti-rheumatic drugs, explain the serious side effects of non-steroid anti-inflammatory drugs, commonly shortened as NSAIDs, explain appropriate patient education for those taking skeletal muscle relaxants and NSAIDs, describe medications for osteoporosis prevention and treatment, compare and contrast your COX-2 inhibitors and other NSAIDs. NSAIDs are the most commonly used medication to treat musculoskeletal ailments. These drugs are prescribed for their anti-inflammatory properties and analgesic properties. Okay, so skeletal muscle relaxants are used to manage many disorders involving pain, spasm, abnormal contraction, or impaired mobility. These drugs are prescribed based on the patient's condition, and it can be short-term for acute pain, or it can be long-term for chronic conditions. Some muscle relaxants affect the CNS, where others affect just the skeletal muscles. You're looking at a table that has your non-direct acting skeletal muscle relaxant. It gives you the action and it gives you an example of the medication. And on the other side of the table, the right-hand side, we talk about, or it discusses the direct acting skeletal muscle stimulants, and it gives you the actions. And it gives us the drug dantrolene. But let me just say this, that this medication is ineffective for ALS and is not indicated for the treatment of muscle spasms resulting from rheumatic disorders or musculoskeletal trauma, which is your acute injuries. And I want to just mention too, the SAMA drug is a Schedule 4 controlled substance. You remember we talked about controlled substances early on? So SAMA is used to help with muscle relaxants, but it is considered a Schedule 4 controlled substance. Let's take a look at the side effects of skeletal muscle relaxants, and they are drowsiness, dizziness or dry mouth, weakness, tremor, ataxia and seizures, confusion and nervousness, slurred speech, blurred vision, and hypertension. And there is an alert for potential abuse. What are some of our cautions, our contraindications? And they are pregnancy or lactation, history of drug abuse, impaired kidney function, liver disorders, older adults, abrupt discontinuation, angle closure glaucoma, and some of our interactions are alcohol, analgesic, psychotropic medications, and antihistamines. This is Table 20-1 that you can see in your ebook. This is your medications, the trade name, the dosage, and the comments. Make sure that you read them and get very familiar with them. Knowledge check activity. Which are potential side effects of skeletal muscle relaxants? Check all that apply. Write your answers down and we'll check them at the end of the video. Now, neuromuscular blocking agents. A drug category of muscle relaxants that results in a direct effect on muscles, including the diaphragm, is called your neuromuscular blocking agents, your NMBAs. Your NMBAs, such as your
succinylcholine
and your
rocuronium,
are used with the intended effort of total muscle paralysis. The patient receiving NMBAs cannot move or breathe without assistance, but awareness remains intact. These drugs are only administered by anesthesiologists or other healthcare professionals trained in intubation, medically produce paralysis and resuscitation. Drugs that are potentially dangerous and can result in respiratory arrest due to the potential to paralyze the major muscle of ventilation and diaphragm include the
succinylcholine
and the
rocuronium.
Knowledge check activity. Which NMBA agent possessed a high risk of causing respiratory arrest and must be administered by an anesthesiologist to ensure proper dosing and monitoring? Look at your choices, write down your answer, and we'll check it at the end of the video. Skeletal muscle relaxant patient education. So the potential side effects are drowsiness, dizziness, weakness, tremor, blurred vision, hypertension, respiratory distress, or GI disorders. They just need to be careful when driving, especially until the effects are known, so we know how it's going to affect them. Avoidance of any other CNS depressants at the same time. Be like tranquilizers, antihistamines, or alcohol, because which can cause serious CNS depression and care. Also with analgesics, only as prescribed by a physician. Importance of following the physician's order regarding rest and physical therapy. And then exercise as prescribed to strengthen the weak muscles. The acronym RICE means rest, ice, compression, elastic bandage, elevation. Represents appropriate care initially for musculoskeletal injuries to extremities. A recent addition has been the focus on prevention of the injury, so some modify the acronym to PRICE. Taking the medication only as absolutely necessary and observing caution regarding prolonged use, which can lead to physical or psychological dependence and withdrawal symptoms. Now let's check your activity. Which best represents the acronym RICE? Look at your choices, write down your answer, and we'll check them at the end of the video. Okay. Anti-inflammatory drugs versus anti-rheumatic drugs. Our anti-inflammatory drugs help us to reduce the inflammation and swelling and are used to treat disorders in which musculoskeletal system is not functioning properly because of inflammation. Conditions such as arthritis, bursitis, spondylitis, gout, and muscle strains and sprains can cause swelling, redness, heat, pain, and limited muscle and joint mobility. Your analgesics and your corticosteroids are used at times for the acute stages of disorders and are discussed in chapters 19 and 23. Some medication examples are like your Tylenol and hydrocodone. Your anti-rheumatic drugs are like your NSAID drugs, inhibit the synthesis of prostaglandins, which are substances responsible for producing much of the inflammation and pain of rheumatic conditions, sprains, and menstrual cramps. No cure has been found for rheumatic disorder, but many medications are used to alleviate the pain and crippling effects. Your aspirin are the oldest drug in the category with analgesics, anti-inflammatory, and antipyretic effects. That's in your chapter 19. Older adults or debilitated patients do not tolerate ulceration or bleeding, and two, it's silent, as well as other individuals, and most reports of fatal GI events are found in these populations. So some of your examples are diclofenac and ibuprofen. Diclofenac is also available topically as 1% gel and a 1.3% patch. Now let's check activity. Which drug category does diclofenac belong to? Look at your choices and write down your answer, and we'll check them at the end of the video. Anti-inflammatory drugs. Anti-inflammatory drugs are used to treat disorders in which the musculoskeletal system is not functioning properly due to inflammation. Anti-inflammatory drugs result in analgesia and anti-inflammatory effects. Common conditions managed with anti-inflammatory drugs include arthritis, bursitis, gout, spondylitis, muscle strain, and sprains. Non-steroidal anti-inflammatory drugs, shortened for NSAIDs, its action is to inhibit the synthesis of
prostaglandins,
substance responsible for producing the inflammation and pain of rheumatic conditions, sprains, and menstrual cramps. Some of your examples are Motrin, Excitrin, Aleve, and Celebrex, but you will see the other medication names there. COX-2 inhibitors, your action is, its job is to block the COX-2 enzyme at the site of the inflammation. The benefit of COX-2 inhibitors is that they do not block COX-1, therefore it does not inhibit platelet aggregation or inhibit the production of mucosa protective
prostaglandins,
Although the benefit is decreased risk of bleeding, there is an associated increased risk of myocardial infarction, high blood pressure, arteriosclerosis, and clotting. Some examples are Celebrex and Vox. The benefits are fewer gastric problems and less GI bleeding. Okay. So what do we have now? Some side effects of our NSAIDs. And then our cautions, our contraindications. It's in a table form. It's broken down for you. I'm going to let you pause the video for a minute and read those. Anti-inflammatory drugs. We're going to look at the drug and the potential interaction effect of those. Alcohol, what they do is potentiate the possibility of GI bleeding. Your anticoagulants potentiate the possibility of bleeding, which is also true for vitamin E. Corticosteroids increase the chance of GI effects with prolonged administration of NSAIDs. Your aspirin, it increases adverse GI effects and diminishes the risk-reducing effects of COX-2 inhibitors in the GI tract. Non-selected NSAIDs may decrease the antiplatelet effects of aspirin. Give NSAID 30 minutes after or 8 hours prior to aspirin ingestion. Our antihypertensive is intuitive response. Lithium decreased clearance. Methotrexate, which potentiates and increases the risk of methotrexate toxicity. Your uricosurics, your probenecid and your sulfenpyrosome, which their action is to antagonize or is antagonized by salicylates. We also need to make sure we look at table 21-2, and it talks about the NSAIDs drug, and also read the clinical connection and patient education, which is on page 444 in your ebook. Knowledge check activity, which is a serious side effect of non-steroid anti-inflammatory medication. Check all that's applied. Look at your answers and write them down, and we're going to check them at the end of the video. Alright, another knowledge check activity, which side effect is present with COX-2 inhibitors that is not present with NSAIDs. Look at your choices and write down your answers, and we'll check them at the end of the video. Osteoporosis therapy. Osteoporosis with porous bone is defined as a systemic skeletal disease characterized by low bone mass and deterioration of bone tissue, leading to bone fragility and increased susceptibility to fracture, especially of the hip, spine, and wrist. What you're looking at on the screen is on your left-hand side, you see a normal bone. On your right-hand side, you see a bone that has osteoporosis.
bisphosphonates,
Are non-hormonal agents that act directly to inhibit bone reabsorption, thereby increasing bone mineral density at the spine and hip, as well as decreasing the incidence of first and future fractures. Remains in circulation months to years after the drug is stopped. And some examples of those medications are Fosamax, Beniva, Atenil, and Reclass. Hormones, they're shortened by hormone replacement therapy, which is your estrogen with or without progestin, is recommended for patients that has postmenopausal osteoporosis prevention. It is secondary to estrogen deficiency only when patients are unable to take other agents and when the benefits outweigh the risk. Some examples of that is your estrogens, selective estrogen receptor modifiers, calcitonin, parathyroid hormone, and monoclonal antibodies. I also want to mention the relaxafen, which is your Invista. This information can be found page 446. Is a selected estrogen receptor modifier, which is shortened for SERM, SERM, with estrogen agonist activity on bone and lipids, and estrogen antagonist activity on breast and uterine tissue. These properties result in increased bone mineral density, decreased bone reabsorption, and reduced fracture risk without promoting breast or endometrial cancer. Make sure that you take a look at table 21-3 of the agents for osteoporosis prevention therapy. Now let's check activity. Which supplement is prescribed with calcium to enhance bone absorption? Look at your choices and write down your answer. We'll check them at the end of the video. Okay, we're going to take a look at the case study to see if you can answer it. An older adult patient presents to the emergency room with a fractured hip and a broken arm. The patient reportedly slipped and fell on the sidewalk while going to their mailbox. The patient reports that they were treated a few years ago for a fractured ankle, which raised concern to the treating physician. Upon further review of the patient's chart, they noted that the patient recently underwent a bone density test 3 days prior and found the results to be abnormally low. Which diagnoses will the physician note in the patient's chart, along with a treatment plan for the current injuries? Look at your choices, write them down, and we're going to check our answers in just a few. Okay, so we are getting closer to the end of this video. I want to remind you to make sure that you read the patient educations, as it is our job to make sure that our patients are taken care of and that we educate them correctly. And it also has valuable information in those. So make sure that you are reading the patient education boxes. In the self-assessment that you're currently looking at, ask yourself, what are the contraindications of musculoskeletal medications? What are the different anti-inflammatory drugs covered in this chapter? And 3, identify the different therapies used for the treatment of osteoporosis. Alright, this is the answer to knowledge check activities. Pause the video and check your answer, and let's see how much are you retaining. Let me know if you have any questions, and thank you for listening.